Amman Reconstructive Surgery Hospital has been opened in 2006, initially dedicated for Iraqi patients victims of war and violence. And in the last decade, it has opened the admissions to other neighboring countries like Yemen, Palestine, and Syria. The capacity of the hospital is to admit on average 50 patients per month. And this is what has been done in the last 15 years. Unfortunately, in 2020, the whole world and the hospital in particular had to face the impact of the COVID-19 pandemics, and we had to slow down and at the end even stop the surgical activities to some extent because of the difficulty for the patients to come in Jordan and to receive a proper treatment. The networks of doctors in the country of origin of the patients unfortunately could not offer or organize a proper travel to Amman for the patients, and the waiting list accumulated to reach at the end of last year 517 patients. So today and this year the objective is to manage as much as we can the waiting list, try to have these patients access to a treatment, and we are trying to develop also a network of doctors and treatment centers who could offer some of the services to the patients without having them coming to Amman. We have a physiotherapy center in Baghdad, we have physiotherapy and surgical capacity as well in Yemen. In Iraq, we are developing that. In Palestine, we also have a hospital with advanced surgery, so we're trying as much as we can to have these patients access to a treatment despite the COVID pandemic. So recently, in the last week, the Jordan authorities are facing again a rather steady influx of number of COVID cases confirmed. They are reaching 6,000 to 7,000 cases per day, and it's again for the second time slow down the level of activity in Amman Surgical Hospital, and we are slowly turning part of this hospital into a COVID center, able to treat 30 patients, moderate cases, just to avoid these patients to be admitted in intensive care unit in the public health system. Since the beginning of the project, we have admitted more than 6,000 patients and performed almost 15,000 surgeries. Unfortunately, last year and this year, the activity will slow down, and we have admitted in 2020 half of our capacity. So we are trying as much again as we can to manage this waiting list and to avoid the patients to wait too long before they receive a proper treatment. Part of the rehabilitation care we propose to in Amman include infection management, and this is one of the very important also medical achievements we have managed to reach in Amman. So beside the surgical treatment and the rehabilitation treatment, we have open diagnostic units in the hospital, including a microbiology lab that is performing tests, analysis of samples, biopsy samples, bone samples, to be able to properly identify the bacteria and prescribe the proper drug for the patients. This allowed us to develop what we call the stewardship program when it comes to antibiotics, where the prescription is followed and managed on a multidisciplinary approach in the medical department. So we have people in charge of following this infection management on a very, very accurate basis. First, to avoid the spreading of the infection, and second, because we know that the infection is a source of complication for the patients who could have difficulty to properly recover functionality of his injured limb. Today we are in the Dubai International Humanitarian and Aid Conference. So we have a booth present here, and we have the chance to present the Amman Reconstructive Surgery program to a panel of people who showed interest from doctors and other medical and humanitarian workers, and we were the chance to share a bit our experience and our projects to the community present here.